everyone. Happy Friday. Thanks for joining us again. My name is Dr. Roberta Westbrook, and I am the Chief Animal Welfare and Medical Officer here at the Houston SPCA, the campus for all animals. Thank you for joining us today. We have a very exciting show for you today. Lots of great information. Our topic is going to be heartworm disease. Heartworm disease, a very common disease that we see in our dogs and even our cats, particularly here in the South. This disease can be very serious and life-threatening, so I want to give you a lot of good information to prevent it. Before we get into heartworm disease, I want to show you one of our wonderful pets that's up for adoption this weekend. Her name is Muse. Look at this cute dog here, Muse. Muse is very well behaved. She sits. She knows how to shake, particularly for treats. So she's a really, really good dog. She's so focused on that treat. She's going to make someone a wonderful, wonderful family pet. The interesting thing about Muse is Muse came to us from Louisiana. She was part of a group of animals that we brought from Louisiana in preparation for the hurricane. And so Hurricane Ida. So she came with us. She's here with us. And Muse is just a wonderful dog looking for a great home. Muse also has heartworm disease, but you can see that she's doing well. And the Houston SPCA can give you all the information about how we treat heartworm disease and how, as the new adopter in her new family, you will have to do very little to help get Muse all the way healthy. She is a wonderful, wonderful dog. What have we been up to the last week? So much. Our thoughts are with the people of Louisiana as they continue to recover from the effects of Hurricane Ida. We had a team that went there to help with the animal shelter in New Orleans. We have a team there now who's helping to deal with the stray animal population in Louisiana. And so we are on the ground trying to help out, trying to get, these animals safe and taken care of during this recovery process. So please, if you want to partner with us, join us, go to the HoustonSPCA.org/donate and help us to help our friends in Louisiana. So start thinking about all your questions that you have about heartworm disease, because it's a very important topic. I'm going to get right to it. I do want to let you all know that I have some live specimens here. And what I mean by live specimens, I have an actual heart here from a patient that had heartworm disease. And so I want to show you how real this disease is and how it can absolutely be life-threatening. So let's start with what is heartworm disease. Heartworm disease is a parasite. It's a worm, a literal worm that gets transmitted to dogs. It can be transmitted to cats and even ferrets and certainly some other canine type species. But we're talking about dogs and cats primarily here. It is spread through the bite of a mosquito. So what happens is, let's say we have a dog that has heartworm disease. That dog can be bitten by a mosquito. As the mosquito takes a blood meal from the dog, the mosquito can also ingest the very microscopic baby heartworms. Inside the mosquito, those baby heartworms begin to grow and they turn into larvae, or a more mature stage of the heartworm. The next thing that happens is that mosquito bites another dog and transmits the larvae into the second dog. And that's how heartworm disease is passed on. It's through the mosquito. So you can imagine right now, just think of all of the states that have high mosquito populations, right here in Houston, right here in Texas, and all the southern states, how much of a mosquito population we deal with every year. You know that just walking to your car during the summer months, you can get 5 or 6 or 10 mosquito bites. The same thing is happening to your dog and possibly your cat when they're outside. So a common misconception is that if your dog or cat spends a lot of time indoors, they're not going to get heartworm disease. That's not true. It just takes one mosquito bite, and it takes a very short period of time. We know that because when we're outdoors just chatting or walking to the mailbox or going to the car, we can suffer several mosquito bites ourselves. So don't think that just because your pet only goes outside to go to the bathroom, that they cannot get this disease called heartworm disease. So as I mentioned, once a mosquito transmits this larvae to a second dog, transmits this heartworm disease, the larvae, the worm, goes through several life stages before it becomes an adult. The adult heartworms live inside the heart, hence the name. They live inside the heart. Don't be confused by intestinal worms that you can see in the feces, in the stool. It's not the same thing. Some people think when their pet is going to the bathroom and they defecate, they have a bowel movement and you see parasites. That's a different parasite. Heartworms live in the bloodstream, in the circulatory stream, and in the heart, which is why it can be life-threatening, because it can lead to heart failure. And so take a moment, if you're a little bit squeamish, or if you feel like it's going to be too difficult to look at this specimen of a heart that has the actual heartworms in it, you can take this moment to look away or come back in a few minutes. But I do want to show you all this heart from a dog that had heartworm disease. So what we're seeing here is an actual heart. It's been preserved with formalin for the last 48 hours, which is why it may have this grayish purple color, but certainly it did have blood in it. You can see here these worm-like structures. These are the actual heartworms that were found inside of the right ventricle, the right side of the heart. So this heart is a little bit, stiff. It's been preserved, but these are actual heartworms. They can be up to 1 foot long. So they're very, very long. They can be up to 1 foot, 12 inches. You can imagine that as the heart is trying to pump blood to the dog's body, to the brain, that if it has to pump against a big clot of worms, how difficult it would be to get blood to the vital organs. It's not going to be able to get blood to the vital organs, to the brain, to the liver, to the kidneys. And as a result, the heart has to work harder. And so it's pumping harder because it's having to fight against all of these worms here. It's having to fight against that. And over time, the heart gets fatigued. It goes into heart failure. And then we start to see animals with very, very severe reactions to the heartworm disease, including death. So I want to show you guys this because it can be quite devastating to the pets. Those are actual heartworms inside the actual heart. So we can prevent this. The good news is we can prevent your pets from getting this. And your dogs can get, many dozens of heartworms at a time. So it's not just 1 or 2. As you can see, this is probably 20 or 30 heartworms there. Cats can also get heartworm disease. Many people think cats don't get heartworm disease. They can get heartworm disease. And as a matter of fact, in cats, it can be more devastating because in cats, unfortunately, they can suffer from heart failure much quicker. Sorry, I think something got my eye. They can suffer from the heart failure much quicker than the dogs. And so sometimes in cats, sudden death is one of the unfortunate consequences of heartworm disease. But this is an actual heart. We also have a couple of other preserved hearts. This is a very common condition. It has been found in every single state in the United States. Every single state. So even if you live up north, you think it's cold, we don't have a high mosquito population. You can see the worms in here. You think, I live up north, there's not a high mosquito population. Heartworm disease has been found in every state. It's less common in colder states because the mosquito population is lower, but it's still there, which means we want to help you prevent it. And we'll talk about that. Before I get into how do we prevent this? How do we keep our pets safe? Let me know if you have any questions. Does anybody have any questions about what I've discussed so far as it relates to heartworm disease in our pets?
Yeah, so Casey wants to know if heartworms affect other pets. I know you mentioned cats, but something like potbelly pigs.
Oh, very, very good question. So the most common species are dogs, cats, and ferrets, and other mammals, foxes, coyotes. And so we have not recognized it in any high level in potbelly pigs. I guess it's not impossible. In rare cases in some countries, heartworm disease has even been found in people. So it certainly isn't common, and we don't do anything to prevent it in potbelly pigs. But I would be just very careful about heartworm disease, particularly in our companion animal species. But great questions. Any other questions about heartworm disease?
So Jamie wanted to ask about if she's never had her dog on heartworm prevention before, should she get her dog tested first before she puts?
Yes, absolutely. So this is a great question, which is, once a mosquito bites your dog or your cat, how long will it take before you know whether your pet has actually contracted heartworm disease? It takes about 6 months to know that. So if your dog gets bitten by a mosquito today, it can take 6 months before a test will actually be able to detect the heartworm disease. So I would say if your pet is over 6 months and they've never been on heartworm prevention and never been tested, absolutely, please get the test. And then your veterinarian can prescribe a heartworm preventive, a medication to give your pet to prevent them from getting the heartworm disease. Now, I'll show you a couple of options. We do have one brand of heartworm prevention here. It's a once a month chewable tablet, but heartworm prevention medications can come in several different kind of types. And so there are some that are oral and given every month. You can even get a topical liquid that you can put on the skin between the shoulder blades. There's even an injection that you can have a veterinarian give your pet that lasts every 6 months. Please see your family veterinarian to determine which type of heartworm prevention is best for your pet. Is it the oral? Is it the injectable? Is it the topical? Which one is going to be best for your pet? And so what we're going to do with Muse, for example, as you see here, Muse, even though Muse is heartworm positive, Muse is part of a program in which her new adopters can get her heartworm treated through VCA, a partnership that we have with local animal hospitals called VCA. They will treat our pets for heartworm disease and get them back to a completely healthy stage of life where they can go on to live a long life. So Muse is doing great, and she's well on her way to getting heartworm treated and living a long, healthy life. So these are the different types of heartworm prevention. Any other questions?
I kind of wanted to know about, you had mentioned, it's caused by a mosquito bite. Is there a certain type of mosquito, or is it in maybe some areas where there's a lot of standing water, like maybe after a hurricane?
Absolutely. That's a great question. So certainly where mosquitoes congregate or lay eggs, stagnant water is known, right? Because mosquitoes love to lay their eggs in stagnant water. And so after a hurricane, after a rain, any of those times, the hot summer months, particularly, in the South, it's going to be hottest in the spring and summer. Those are going to be the months where mosquito populations are higher and where heartworm disease certainly may be transmitted more. So I would say when you're walking your pets, number one, your veterinarian can prescribe you a monthly heartworm prevention so that at least your pet is on heartworm prevention. But during those summer months, you can avoid the times where mosquitoes are at their greatest, right? So in the early morning hours and late in the evening when mosquitoes are out, you can avoid those hours to try to cut down on the period of time that your pet has access to the mosquitoes.
Okay, so Casey had a follow-up question. Let's say your dog, or your say dog or cat, but let's say your dog gets tested positive for heartworms. Vet is going to help, but what are the very next steps? And in addition to medication, there's probably some other precautions they have to take as well.
Yes. So once your pet has been diagnosed with heartworm disease, you may be wondering, are they going to go into heart failure right away? Am I going to be seeing symptoms right away? Let's start with the symptoms of heartworm disease. So in the early stages, there may not be any symptoms at all, and your dog and your cat can act completely normal. As the disease advances and the heartworms become more numerous and they live in the heart and the pulmonary artery, the blood vessel that actually leads to the lungs, you can start to see symptoms associated with that, which include coughing. It can include exercise intolerance. It can include lethargy. So your pet may be tired and not wanting to exercise. It can include vomiting in some cases, and even bleeding in some cases. So the most common symptoms are coughing, exercise intolerance, and lethargy. But generally, if we can diagnose your pet with heartworm disease while it's in the early stages and while they don't have symptoms, their long-term prognosis is much better. So it can take several years for the heartworms to get to a point to where your pet experiences heart failure. But what we want to do is diagnose it very early so that we can do treatment and make sure that we can get them back to a healthy state. When we talk about treatment, so once your pet is diagnosed, your veterinarian is going to prescribe you a series of medications that can help to treat heartworms. And so there are some supportive medications that we can give. One of those is an antibiotic that your veterinarian may put your dog on. An antibiotic is not going to kill the worms, but what it does is it helps to weaken them. It kills a bacteria that the worms feed off of, and so it can actually help to weaken them and make the heartworm treatment more effective. So that's one thing that your veterinarian might prescribe to you, an antibiotic. Your veterinarian might also prescribe to you an anti-inflammatory, like a steroid, like prednisone. And what that does is it helps to decrease the inflammation in the lungs, because as you can imagine, these heartworms live in the heart, and sometimes they can actually cause a lot of lung disease as well. And so we want to decrease that inflammation so that your pet does not have difficulty breathing. So antibiotics, anti-inflammatory, and then some veterinarians may start your pet on a regimen of a heartworm prevention that they prefer. It could be an oral, could be a topical. So you might have that. And then finally, the actual treatment requires a series of injections. So the medication that treats heartworms is a series of injections that are given in the back muscles, right in the back. And this is usually given in 2 or 3 injections by a veterinarian, and that will kill the adult heartworms over a period of time. And so your family veterinarian can discuss these things with you, can talk to you about the process and how long it may take to get your dog healthy, but it's a treatable disease. But let me just tell you, it is so much less expensive to prevent this disease. A once a month chewable tablet may run you between $5 and $12, depending on the size of your dog, per month. $5 a month, maybe about $12 a month, depending on the size of your dog. But when we're talking about treating your pet for heartworm disease after they've been diagnosed and they now have to have treatment, it could be thousands of dollars. It could be thousands of dollars, not to mention the pressure that it's on you and on the pet that's needing to be treated. And so preventing this disease is so much better than having to treat it. It's just so common here in the southern states, really in every state, that we see it a lot. And so we can deal with it. And we know that the animals overall have a good long-term prognosis. Any other questions about heartworm disease?
So Jacqueline wanted to know, we do have a lot of pets, as you mentioned, that come through the Houston SPCA that are heartworm positive. When people are considering adoption, what should they know? They've adopted a pet here. What's the very next steps once they walk out the door?
Absolutely. If you have adopted a heartworm positive pet with us, please schedule an appointment with the VCA hospital nearest you or the one of your choice. They will do another evaluation of your pet, and they will get you started on all of the medications and the treatment plan to get your pet treated for heartworm disease. The Houston SPCA covers the most expensive portion of that treatment, which is the actual injections, the medication to kill the adult heartworms. The Houston SPCA covers that. You as the new adopter will cover some of the medication to help prevent the disease in the future, so heartworm prevention. and the antibiotics that go along with that. But Houston SPCA covers those costs, and we are so grateful for VCA to help us get these animals healthy. We appreciate all their support of us and the dogs that are having to go through heartworm treatment.
Is heartworm disease, is that contagious? So if you bring another pet in who's heartworm positive, can my other dog at home get it?
Right, great question as well. So heartworm disease is transmitted through mosquitoes. So it's not directly contagious. If you have a heartworm positive dog and a heartworm negative dog living in the same household, it does not mean that the heartworm negative dog will get heartworm disease from the heartworm positive dog. It does require the mosquito to transmit it, but certainly a mosquito that bites a heartworm positive dog and then later bites a heartworm negative dog could transmit the disease. So in that way, it's possible to transmit it.
Patrick wants to know what happens if his dog is on heartworm prevention, but they skip a couple of months.
Also, very common and a great question. What happens if you are on a monthly oral heartworm prevention and life happens? It happens to all of us. You're a couple of days late, a couple of weeks late, or you missed the dose for the month. Start your pet back on the heartworm prevention. Just start your pet back on the heartworm prevention and schedule an appointment with your family veterinarian so that they can do a test to make sure that your pet is not positive. It does take 6 months, but what they'll do is they'll likely do an initial test to make sure your pet is negative at that moment. And then they will test 6 months from the missed dose. Because remember, it takes 6 months for heartworm disease to be detectable. So if you missed the dose in August, for example, your veterinarian is going to wait 6 months and then test and see if during that month that you missed the dose, if your pet contracted heartworm disease, then 6 months later, we may be able to detect that.
Is it dangerous for a dog who just gets put on heartworm prevention and there's no test?
That's a great question as well. So it is possible that if we don't know that a dog is heartworm positive and we put them on certain preventatives, some preventatives have higher risks than others, but we put them on certain preventatives. Sometimes those preventatives can cause a reaction. And that reaction is a sudden death of the heartworms, and that can cause an animal to have sudden coughing, difficulty breathing, lethargy. So they can have a reaction, not necessarily to the medication itself. It's just that the medication suddenly caused death of the heartworms, and it created an inflammatory reaction in the lungs in which the animal was coughing, having trouble breathing. And so that's why you want to get a test initially so that we know whether or not your pet is heartworm positive or not. Again, there are some preventatives that are reported to be more likely to cause those reactions in a heartworm positive dog, and some are less likely. Again, which is why you want to get tested and have your veterinarian talk to you about which preventatives they would prefer you give your pet.
I think we're about ready to wrap.
Well, this was wonderful. Thank you guys again for tuning in. Heartworm disease, it's such an important topic for us to talk about. We're happy to help you in the future answer any of those questions. Please come on down to our campus and consider adopting a new pet into your family. Come this weekend. There's no appointment necessary. You can just come on down, bring your family and friends. Next Saturday is a wonderful event that we call Clear the Shelters. It's a big adoption event. We want to get all of our animals into new permanent homes. So come on down this weekend and next weekend and help us find homes for these pets. Thank you again for joining us, and visit HoustonSPCA.org/donate to help us continue to save lives. Thank you, and we'll see you next week.